Most women in their reproductive years accept menstruation as a normal part of life, if not exactly their favorite part. Though frequency, duration, and other period-related matters may vary from one girl or woman to the next, the fact that you get one is healthy, and not getting your period, called amenorrhea, may signal that something is amiss. In the US, only about 2% of adolescent girls have not reached menarche by age 15 years. The prevalence of secondary amenorrhea not caused by physiologic changes is approximately 3% to 4% of reproductive females. In this video, we will talk about this disease, amenorrhea, by answering these questions. What is amenorrhea? What causes amenorrhea? Symptoms of amenorrhea. How's it treated? What is amenorrhea? Amenorrhea or amenorrhea is the absence of a menstrual period in a female who has reached reproductive age. Physiological states of amenorrhea are seen, most commonly, during pregnancy and lactation. Outside the reproductive years, there is absence of menses during childhood and after menopause. There are many factors that can affect your period, including issues with the following organs and structures. Hypothalamus controls your pituitary gland, which affects ovulation, releasing an egg. Ovaries store and produce the egg for ovulation and the hormones estrogen and progesterone. Uterus responds to the hormones by thickening your uterine lining. This lining sheds as your menstrual period if there's no pregnancy. Amenorrhea, or the absence of menstrual periods, can lead to various complications and health risks, especially when it persists over an extended period. Here are some potential complications associated with amenorrhea. You may have infertility if you do not ovulate regularly. You are at higher risk of miscarriage if your amenorrhea is due to hormone imbalance. You are at risk of osteoporosis and cardiovascular disease due to insufficient estrogen levels. You may have pelvic pain if amenorrhea is secondary to an anatomical problem. You may develop psychological stress from missing periods. Amenorrhea can be classified as either primary or secondary amenorrhea. Primary amenorrhea is defined as having no history of menstruation by the age of 15 years or 3 years after thelarche. Secondary amenorrhea is defined as the absence of menses for greater than or equal to 3 months in a woman with previously regular menstrual cycles or greater than or equal to 6 months in any woman with at least one previous spontaneous menstruation. What causes amenorrhea? Natural amenorrhea due to pregnancy, breastfeeding, or menopause. Medications, such as contraceptives, allergy and blood pressure drugs, antipsychotics, antidepressants, and chemotherapy. Lifestyle factors such as excessive exercise, high energy expenditure, low body fat, being underweight or 10% less than regular weight, common in athletes or ballet dancers, and eating disorders such as bulimia or anorexia nervosa can disrupt the menstrual cycle. Psychological stress can impact hormone levels and menstruation. Hormonal imbalance from health conditions, such as polycystic ovary syndrome, PCOS, that always keeps your hormone levels high, abnormal thyroid hormone secretions such as hyperthyroidism or hypothyroidism causing menstrual irregularities, pituitary tumors, and premature menopause. Structural problems of reproductive organs. Intrauterine adhesions, Asherman syndrome, can develop after cesarean section, surgery for uterine adhesion, or dilation and curettage. Congenital absence of reproductive organs such as the uterus, cervix, or vagina. Constricted or obstructed vagina can obstruct menstrual flow. Symptoms of amenorrhea. The main symptom is the lack of periods. Other symptoms depend on the cause. You may experience hot flashes, nipples leaking milk, vaginal dryness, headaches, vision changes, acne, excess hair growth on your face and body. How's it treated? Treatment depends on the underlying cause of your amenorrhea and may include following a diet and exercise plan that helps you maintain a weight that's healthy for you. Stress management techniques. Changing exercise levels. Hormonal treatment, medication, as prescribed by your healthcare provider. Surgery, in rare cases. In addition, your healthcare provider may recommend some treatments to help with the side effects of amenorrhea. Estrogen therapy to relieve hot flashes and vaginal dryness. Calcium and vitamin D supplements to keep bones strong. Strength training, lifting weights or doing movements to strengthen your muscles. Thank you for listening to all the information we want to introduce to you in this video. Do not forget to like, share, and subscribe for the HeInfo channel.